Hi,
How are
can
you
I
doing
get
today?
this? Good, how are you?
I'm good, thanks.
Can I get this filled?
Absolutely. All right, so you have a prescription for Biaxin. What are you going to be taking this for?
I have a chest infection.
Chest infection,
Yeah,
okay.
cough.
When did your chest infection start?
It's probably a week ago. I felt like I was getting a cold, and then it
Okay.
just didn't go away.
So describe to me some of the symptoms that you're feeling.
Yeah, I just feel really short of breath, and
Okay.
it's kind of wet and productive. And
Okay, so you have a productive cough?
yeah.
Okay. All right, and have you tried anything to treat this other than the Biaxin?
I tried just some cough syrup to try and
Cough syrup, okay. All right. So, do you have any allergies?
penicillin.
Penicillin, okay. And any other medical conditions that I should be aware of?
Yeah, I have high lipids or something like that.
High lipids, okay.
And I take something for my blood pressure, and I have asthma.
Okay.
And then I also take something for my thyroid.
All right. Well, it doesn't look like anything has changed from your profile. And so I see you're on salbutamol for the asthma, I'm assuming? And have you been taking that since you've experienced these cold symptoms?
Yeah, I need to use it more because
More? Okay.
my cough.
Okay. I am slightly worried about possibly the penicillin allergy. There might be a little bit of cross reaction there. Maybe I could get a timeout here just to talk about the therapeutics or something.
Sure.
Okay. I knew there was a cross allergy with a couple like the amoxicillin, but I don't know if clarithromycin.
Are you taking torvastatin?
Yeah, she's got a torvastatin.
So
Can you
Clarithromycin.
just answer? Just wait, hang on.
Oh.
Can you answer her antibiotic? Is this what kind of an antibiotic is
it's
this?
macrolide.
Oh, macrolide, right.
Okay, keep going. Time out.
Okay.
Time in.
Okay, so the atorvastatin that you're on, that could be a bad interaction with the Biaxin. Because of the macrolide interaction. And so, my recommendation,
So what would happen if I took them both?
I would have to look into that more. I'd want to do some checking into some other resources just to make sure I'm answering your question correctly.
Okay.
And make sure that we're not getting bad interactions. So I don't want to give this out right now, just because I know these could interact poorly.
Okay.
So, but as for what kind of effect you would get and what I want to do to avoid this interaction, I think I just want to look at some other resources, possibly talk to some colleagues, and then get back to you, if that's okay.
Sure.
So,
Okay, I'm going to interject again.
Okay.
I'm going to call a timeout. Keep going, Jonathan. You started about the stat.
Okay, yeah, I was just asking because I know there's an interaction between Clarithromycin and atorvastatin, and the fact that they're both metabolized by the CYP3A4 enzyme in the liver, and so it can cause increased levels of both medications, I believe. I think that's how it was.
so
Does that help? Can you
Yeah,
go back in again? Back in.
I just am not sure what I would recommend, like, to not have that. I mean, maybe a different antibiotic drug. But I mean, I can't change the prescription, right?
What other things could you do?
Decreased dose, maybe? I don't know.
Okay, I'll stop right there. Okay, Lauren.
'Kay.
All right, Lauren. Sorry, I was going to
Yep,
call
Lauren.
you Laura. Okay, can you fill her in more on the statin therapeutics?
Yeah, so what it is that the statin, like Jonathan was saying, they do interact, and the macrolide has a chance of increasing the amount of statin that gets into your body, right? Like gets used. So it's kind of, you have a few different options. Like you said, you could change the antibiotic. Some people just recommend staying on the most because it's a short course.
Okay.
Or if you were worried, sometimes people recommend just stopping the statin for the course of therapy and a few days after, right? So they just take the antibiotic and don't take the statin.
Oh,
for
okay.
those 10 days.
Because
So
that
those
probably
are-
wouldn't be harmful to just remove the statin.
Because it's a long-term therapy, right?
yeah.
So those are kind of your three options. So I don't know
Okay.
if you want to pick one and work from there, or like, I don't know.
What could have you asked now that you've seen that she's on this statin?
Yeah.
To help you make that decision whether to stay on the statin or not, what sort of questions could you have asked her?
How long she's been on it?
How long? Yeah. Control?
Um,
If she's well maintained for 5 years,
right.
going off it for 10 days,
Not a big deal.
Not a big deal.
Right.
Okay. Okay, now we're going back to the entire process. What questions did she miss at the beginning? What did she do wrong?
She introduced herself.
Yeah.
Should I stop it?
And then
Hmm? Yeah.